My name is Shelley Ries, and I'm in Corvallis, Oregon. I'm just turned 59. I've been completely disabled with illness for since 2002. 5 years was the last time I worked. I was perfectly healthy one night, and when I woke up, I wasn't. My diagnosis in the United States is chronic fatigue syndrome. The European diagnosis is myalgic encephalomyelitis. In Europe, they know that it's caused by a virus, one of the enteroviruses, and it attaches to the muscles and makes it difficult, very difficult for them to contract, even for the most minor things. And I tried very hard to maintain working. Went from the busiest ER in the country to an ER that had 2 beds, and I wasn't able to maintain stamina to do that job. And so I took 6 weeks off. After I first became ill, I was out of work entirely for 6 months. And then I tried this job for 3 months as a traveling nurse, trying to find a place where I could manage to continue working. And so I had sketchy insurance then, because I was primarily an independent contractor. I COBRA'd my insurance from my last job. The cost of it to me from my work, which was $180 a month, went up to $345 a month. And my copays also went up when I was COBRAing, so it was an astronomical increase. And then I eventually took this job in Alaska where I had, normal health insurance with, copays and that kind of thing. So I was covered. I was too sick to continue. I came back to California and took about another 5 months off. And then I took another job, hoping that I kicked it once and for all, and I went back to another ER, and I made it only about 4 months. And then I went on to disability for 8 months, and I found a telephone advice nurse. I became a telephone advice nurse. I worked at the clinic where my father had been a doctor when I was growing up. But I'm hard of hearing, and even just sitting and talking on the telephone, eventually I made it about 1.5 years, and even that was too much for me. The physical therapist who saw me last year, giving me it's called functional capacity exam, he said, at that point it was 10 years I'd been ill. He said, "You've been sick for 10 years, you've obviously got muscle wasting, muscle atrophy. You at this level of function where you're dangerously tachycardic after 2 minutes of upright sitting." He said, "There is no potential for recovery." I'm on Medicare. After 2 years of permanent disability, after your doctor declares you to be permanently disabled, you need to wait, if you're under 65, for 2 years before you will get Medicare. Why 2 years when your doctor says she ain't never getting out of bed again? I don't know. So I went from being a nurse working inside the system to being uninsured. I was getting $1,200 a month from state disability as my only income. To COBRA my insurance at that point, and this was 5 years ago, they wanted $480 a month out of $1,200. It wasn't possible for me. So because I am a nurse and an aromatherapist, I just went without for want of a nail, the shoe was lost. For want of the shoe, the horse was lost. It's that kind of thing. It's simple, it's cost effective, it's humane, and it enhances society for everyone to have equal access to health care.